Hi, my name is Krista Kaur, and today I'm going to talk about policies that I feel could use reform on a state, national, and global level. Um, the first issue that I want to talk about is the issue of homelessness because it's a major issue in the United States and it stems from the lack of affordable housing. Currently, 16,200 people in Pennsylvania are homeless, and 13 of those are children. This problem continues to get worse, especially in cities such as Pittsburgh that are dealing with gentrification. Um, just in August, 312 households were displaced in East Liberty in order to put in luxury apartments for people who already have privilege, and all the people who don't now are without homes. Um, it's estimated to cost taxpayers $40,000 a year for the homeless to just be out on the streets. And studies show that when people are told to get clean before they apply for housing, they end up returning to poverty and crime and drugs. Um, an example of what I think would be helpful is a local policy that was just enacted in Canada. And it stated that if you don't have a house for 10 days, you're eligible for what they call the Housing First Initiative, which offers housing first before counseling and other services. And that's beneficial because it gives people incentive to get clean and also offers them a supportive environment. The initiative only cost taxpayers $16,281, which is a very big decrease in what it would cost to keep people on the streets. And the results of that have been that emergency room visits and police arrests have decreased by 50% in just a year. On a national level, I feel like the issue of mental health needs to be addressed. The problem currently is that the federal agency isn't spending enough money helping the seriously mental ill and instead focusing on the mental health of all Americans. The House of Representatives just passed an act called the Helping Families in Mental Health Crisis Act, which provides more hospital beds for people dealing with mental illness who need short-term hospitalization. This bill has actually not passed through Senate yet, but it doesn't include increasing funds towards community service for mental health or really the appropriate medical professionals, especially being psychiatrists who can offer appropriate medication for people who seriously need it. And it doesn't offer funding for special education classes in schools. I feel like this issue is very important because the seriously mental ill are most likely to become homeless, incarcerated, or violent, which has been displayed through the shootings in elementary schools that have taken place way more than they should. On a global level, I think that it would be beneficial to establish more rights for refugees who are trying to escape certain death by wars in Middle Eastern countries. In 2015 alone, over 1 million claims for asylums were reported. Right now, the Common European Asylum System ensures the rights of refugees and ensures that they are protected in its member states. However, the European Union hasn't implemented standards throughout the entire Union, and this ends up producing uneven results. For example, the current system doesn't allow free will of refugees to choose areas that they want to travel to or areas that have better economy. Instead, it puts them all in a certain area, and this causes overcrowding and overpopulation. It also doesn't give refugees equal opportunity and doesn't respect their rights as individuals, in my opinion. So I feel like that could use a lot of work. Thank you.